mamas, welcome to more of an educational video. So this is coning versus doming. What is coning? What is doming? Yes, there is a difference, okay? It is two different things. So first and foremost, we are going to go over coning because I would say in our community here, that is probably the most common thing that we are seeing. Let me roll down my pants here. So coning is when the linea alba, which is this connective tissue in the center of our abdominal wall, when it protrudes past the abdominal wall. So the way that that happens is when there is pressure. So if there is pressure coming from the inside of our abdominal wall, if we cannot maintain that pressure through the linea alba, that is how we see coning. The reason that happens is there's several reasons. The most common reason is when there is a diastasis recti. So most commonly we'll see this during pregnancy and then early postpartum. The reason for that is because our linea alba has been stretched, that connective tissue has been stretched to make room for baby, and so there's not as much control, there's not as much tension and strength there to manage that intra-abdominal pressure. And so once that linea alba has been stretched, it can get more difficult to maintain that pressure that is coming from the inside of our abdominal wall and protruding through that center, okay? So what that's gonna look like, I'm gonna try to make this a visual so that y'all can see. All right, I don't know if y'all can see it from, there we go. Can y'all see this line right, trying to get it to show, right here. This is, I can see it from my angle, that is coning. So coning is when we have, for, an easy word to use, a bulge right here in this center. So this is our linea alba. As I was saying, this is what gets stretched and separates during pregnancy, and then, during postpartum that is healing. So there's not as much strength in our linea alba after that stretching. So it's harder to maintain that intra-abdominal pressure. That intra-abdominal pressure is when that pressure is unable to be managed and it sticks through, which is what causes that coning. So what exercises, what movements can cause coning? Outside of the obvious reason that we just talked about, which is that intra-abdominal pressure, what specific exercises and movements can cause that? The first thing is flexion, okay? So that is when our spine is pulling upwards. So that's gonna be your crunches, your sit-ups. Those are typically the first core exercises to go during pregnancy and definitely not postpartum safe. That is the most common time where you will see coning take place, okay? Second thing is pull-ups. So pull-ups, that's a lot of pressure in our intra-abdominal pressure. For those of you who have ever done pull-ups before, you know how hard they are, whether you're pregnant or whether you are not pregnant or postpartum. It's just a difficult exercise. Lots and lots of intra-abdominal pressure comes from pull-ups. And so when our linea alba, when the integrity of that is kind of in shot, you're gonna see coning. Third thing is overhead presses. So literally just overhead press, Arnold press, overhead tricep extension, overhead movements is a very common time when you will see coning appear. Prone core exercises, so push-ups, planks, anything when you are down on the ground, that's a very common time to see coning. Spinal extension, so that's going to be arching, back bends, for those of you who are yoga people, windmill I think is the move for that. And then movements, so shifting from exercises to movements, bearing down or holding your breath. So when you're bracing for an exercise, a lot of times you'll see super heavy weightlifters going and doing that. That is holding your breath and it's bearing down, okay? And when that's a loaded exercise, it's gonna really, really challenge control over that intra-abdominal pressure. Another movement is coughing, laughing, or sneezing. This is most common, again, during pregnancy and postpartum. You'll kind of feel that pressure when you do that. Again, that's because the integrity of our linea alba is being stretched. That's a super common time to feel that, and as silly as it may sound, it's great to engage your core before coughing or sneezing or laughing if you know that your linea alba has been stretched. increasing the load or weight, which kind of goes hand in hand with bearing, well, it doesn't necessarily, but it can go hand in hand with bearing down or holding your breath. The harder and the heavier that load is, the more work it's going to require from your core, making that pressure maybe more prevalent if you can't manage that intra-abdominal pressure as well. And then the last thing, this is a super common one, is laying down or sitting up. If you did training for motherhood with me or core and pelvic floor restore or booty after baby, you have heard me talk about correct ways to lay down and sit up. That is one way where if you aren't controlling your core, or if you are, you have a big enough diastasis recti, it's going to show regardless. So those are the most common ways you will see coning appear. So if you're unsure of what coning is, try out some of those and see if you can see a little bit of coning. So next on my list is how can we avoid / minimize it? Because in pregnancy it is unavoidable. So I like to make sure that I'm saying minimize here as well. Like I just said, laying down and sitting up correctly. That is super, super, super important. I preach that in my pregnancy program over and over again, and in core and pelvic floor restore. Another way though is posture. So how we stand, how we sit, all of that can really affect the integrity of our linea alba, because if we, especially in pregnancy, are standing like this, my core is not engaged right now. There is no core engagement at all. So making sure our ribs are over our pelvis, having a neutral pelvis when we sit, when we stand, is so, so important to make sure we're not putting unnecessary pressure on our linea alba. And this is not only during sitting and standing, this is also during movements as well, so that we can control that intra-abdominal pressure. Another way would be decreasing range of motion. This is mostly applicable during pregnancy and postpartum. An example of that would be, going from a standing exercise to maybe a kneeling or a seated exercise, or instead of doing a chest press, laying completely supine on your back, raising that so that it is an incline chest press. So decreasing that range of motion. Next is breath work, breath work, breath work, breath work. It is so important, y'all. The connection between our breath work and our core is it's synced together. It is so, so important. That's what diaphragmatic breathing is, which I'll talk about in a second. It's the most important part of maintaining that core control. I cannot emphasize that enough. So our breath, if we are, I mentioned earlier, if we're holding our breath, it's going to create more pressure, and it's not going to allow us to manage that intra-abdominal pressure. We want to be constantly inhaling and exhaling, okay? And there is a method to the madness with that. That's a little bit of what diaphragmatic breathing, or if you're pregnant, hugging your baby means. I have several videos on that, but Spartan's version is when we inhale, we are expanding out and down. So pelvic floor goes down, we're inhaling out. Okay, so our ribs go out, our belly goes out, our back goes out, our pelvic floor goes down. On that inhale, we are engaging up and in. Okay, so inhale, expand out and down, inhale, up and in. So ribs come in, back comes in, belly comes in, pelvic floor comes up. If you're unclear on that, I have a diaphragmatic breathing 101 video, highly recommend watching. Next is props for support. And this is, again, more so for during pregnancy, but in everyday life too. Sometimes it can help, allow you to feel that connection and control that pressure more if you're using a prop. So an example of that would be a ball squeeze in between your knees, which we do a ton in postpartum workouts. That is to help our body reconnect that core, or remake that core connection. Another way to do it is in our arms. So an exercise that we do is that leaning back with ball squeeze, okay? Or bear hold with ball squeeze in between our knees. Doing that is encouraging that deep core, that TVA connection. So using props for that is super helpful. And then a cross-body connection. So placing a ball in between, using opposite hand, opposite leg doing that, okay? That is also super prevalent in core and pelvic floor restore. The final thing is to decrease the difficulty. So that could be anything from decreasing the load, the reps, increasing, I know that's the opposite, but increasing the rest, so decreasing, speed at which you perform. But basically decreasing the difficulty of something. A lot of times if we're rushing through something or if it's too heavy, we are unable to manage that intra-abdominal pressure, and that is what leads to coning. So to wrap all of that up, because that is just on coning, coning is directly related to the linea alba and not being able to manage that intra-abdominal pressure that is protruding through the linea alba, okay? Moving on to doming. What is doming? So doming is also known as bread loafing, really because what happens to our abdomen is it looks a little similar to a loaf of bread, okay? So when this happens, our rectus abdominis, which is the six-pack abs. So these are the outermost layer of our abs. So this right here that you can see, this is the rectus abdominis. When our rectus abdominis is over-dominating the TVA, the transverse abdominis. The TVAs are the innermost, deepest level of our core, which is the part of our core that is the hardest to reconnect to after pregnancy, and the hardest, or really the first to go during pregnancy. So when our rectus abdominis, so the outermost layer of our abdomen, overtakes the control of an exercise, we aren't able to connect to our deep core, our TVA, which is the most important part to connect to. When that happens, you will see a bread loaf-like situation happening in your midsection. I could try to demonstrate this. I don't really think it's going to show on camera though. The most common time you'll see this is during a plank or push-up, okay? And then most commonly, I know in the past when I didn't really know what core connection was, I would see this during lower ab exercises. So your V-ups, your flutter kicks, your hollow holds, anything, leg lowers, anything like that on your back. If you are not controlling your core, you're going to see that big bread loaf, which basically different from coning. Coning is going to show up right here, just that small sliver, okay? Bread loaf is literally the entirety of that rectus abdominis, so that six-pack part of our abdomen. So that is the difference there. The most common time that we'll see doming, like I just said, is that lower ab exercise, planking, and then sometimes crunches, but not as common. I think that crunches are going to show coning a little bit more. So how can we avoid this? Doming is basically a muscle imbalance versus, a tissue weakness or a lack of pressure control, which is what coning is. Doming is more of a muscle imbalance, so one is overtaking the other one. So really, how to fix doming is to learn how to connect to your TVA, to your deep core, and recruit your pelvic floor with that. Because when we have that deep core connection, our TVAs are what's taking over the exercise. Yes, our rectus abdominis is still used, but when our TVA is engaged, it doesn't really allow for our rectus abdominis to overtake that. So the main way to fix/avoid doming is to learn how to connect to your deep core. If you struggle with that, my advice is to do core and pelvic floor restore, because that teaches you the foundations from just the very absolute beginning of how to make that connection. Also very, very deeply going into diaphragmatic breathing 101 and learning how to do that. Two other ways would be decreasing the intensity and the load, which is, another reason for coning, or another way to help coning. Rule of thumb is, if the load is too heavy or the intensity is too much, you're gonna not be able to maintain core control or correct engagement in a doming case as well. The last thing, similarly to coning, is posture. Posture is so important, y'all. When we are standing like this or arched too much, we're unable to control our core, especially when we bring that over into exercises. If we start with poor posture in our exercises, we're not going to be able to control our core, which is going to lead to doming and or coning. So that is the difference. To sum it up, coning is a connective tissue pressure issue, which can be strengthened through really just repairing that tissue and bringing that back together. A lot of ways to heal that is going to be time, breathing, mobility, and then working on deep core exercises. I have a ton of deep core workouts on the app. They are literally called Deep Core Workout. There are several of them. There's advanced ones. You could do core and pelvic floor restore, but really just working on that deep core, re-strengthening and reconnecting is the way to work on coning. That being said, if you were pregnant or if you're postpartum, give it time. Coning is going to be a part of that process because diastasis recti is a part of that time of your life. Doming is not necessarily connected to diastasis recti, and it's just a muscle imbalance. And the way to work on that is really focusing on that deep core connection and making sure you've got that down pat. I hope that this is helpful. If you've got any questions, please comment below. Let me know. It can be confusing. I know it can be kind of daunting. Coning is such a popular, common phrase that is thrown around, and I don't think that it's often clarified what the difference in the two is. So I hope that this is helpful. Ask any questions that you may have. If you need guidance on specific workouts to help you get there, they're on the app. I'm happy to help guide you to those workouts. Y'all are awesome. See you for the next one, mamas.